Healthcare is among the most basic but absolutely critical services that any government can offer its people. Healthcare, too, is a personal matter that requires individual proactive action. Synergy between the two is at the heart of ongoing and new prescriptions for the country's health status in the 2018-2019 financial year. Like the human body, Jamaica's national health profile requires holistic treatment, and the ministry's 10-year strategic plan is to allow for just that. 4 policy reviews to be incorporated into that plan are now near or have been completed.
These studies will look in the context of the entire healthcare infrastructure in Jamaica and make a determination as to how we upgrade in order to right-size or optimize the infrastructure that is available.
Other tools in the long-term treatment plan include the initiative to reduce waiting times at hospital A&E departments by upgrading nearby health centers. The ministry is also extending the reach of its partnership with private pharmacies to ensure patients of the public health sector can fill their prescriptions at more outlets.
We have identified another 35 pharmacies, making the total to be 52.
Starting with Victoria Jubilee and the KPH, hospital aesthetics are getting a lift and frontline staff are being groomed to administer clinical care with compassion.
During the course of this year, we intend to roll out to another 12 major clinics within the hospital system this compassionate care and volunteerism policy.
As for the competency of critical care nurses in the public health sector,
we have signed not 1, but 2 bilateral agreements with our partners, China and the United Kingdom, where our Jamaican nurses will train for a part of their advanced training here in Jamaica and then go to Chinese and UK hospitals with their local tutors to complete their clinical rotation.
The St. Joseph's Hospital Cancer Treatment Center is on path to join Cornwall Regional in giving thousands more Jamaicans access to the best cancer treatment technology available. Better critical care is also being offered to our youngest and most vulnerable through upgrades to the Bustamante Hospital for Children.
The operating theatre has now been opened, and we have in fact saved some 31 pediatric young lives since the opening of this.
And the ministry expects to break ground on the China-aided Western Children's Hospital in the 3rd quarter of this financial year or by December.
We must get the fundamentals of good health and wellness by firstly taking personal responsibility. We will expand the Jamaica Moves program to include a health and wellness program, Mr. Speaker. We are going into the workplaces, speaking to employers and helping them to develop health and wellness programs within their entities. We will introduce Jamaica Moves in collaboration with the Ministry of Education and Youth, the Jamaica Moves program in the high school system. The obesity level among our high school age cohort is a major challenge. The government will implement a policy to restrict certain types of sugary drinks in schools. By sugary drinks, we mean beverages that contain sugar or syrup that is added by the manufacturer, except for where there are prescribed dietary guidelines for patients. The same policy will be introduced in our public health infrastructure. Alcohol is the most commonly abused substance in Jamaica among adults and young people. And through a national dialogue, we will advance a national alcohol policy that will take into account underage drinking, advertising to minors, and will incorporate measures to support the new Road Traffic Act. We are advancing this year the comprehensive legislation on tobacco control. It will include mandatory prohibition on tobacco advertising, promotion, and sponsorship, including a ban on point-of-sale tobacco displays, the prohibition of sale of all forms of tobacco products to and by minors, and the regulation of price and tax measures to effectively contribute to the reduction of tobacco consumption. We will engage in the education program for the mental health teams in communities, integrate the mental health message in Jamaica Moves, continue with ongoing training of 30 community health aides in the southern region and then the northeast region. We will develop public-private partnerships with a number of entities out there, NGOs, who currently are in fact treating with those who are homeless and who are mentally challenged. Part of the response is to train teachers, guidance counselors, and physical education coaches in the early detection and referral of mental disorders, particularly depression, build resilient skills and mental health literacy in high school system. Even in the context of insufficient resources, we are fixing what needs to be repaired and putting in preventative measures to forestall problems that have become apparent. As we do our part, it is also for the Jamaican people to take responsibility for their own health.